Welcome back to another episode of Cutting the Boards. If you're about to start residency, you've probably heard plenty of advice about how to be a good intern, to know your patients, to work hard, to be reliable. I've actually made an entire video about that, but this video is about something different. It's about how to actually survive and thrive during intern year. Because PGY1 can be overwhelming. It's much different than medical school and you have a lot of different responsibilities. So these are the things I wish I understood before starting intern year, not necessarily how to impress people, but how to make the year manageable. Without further ado, let's get started. The biggest distinction I want to make is that being a good intern and surviving intern year aren't exactly the same thing. You can be hardworking, prepared, and reliable and still feel completely overwhelmed. Because you also have to learn how to manage an endless workload, deal with fatigue, recover from bad days, instruct medical students, and accept that sometimes you're going to leave the hospital feeling like you didn't accomplish nearly enough. That's the side of intern year I want to talk about. A key thing to remind yourself is that intern year has seasons. July is hard because everything is new. Something that takes your senior 30 seconds might take you 5 minutes because you don't even know where to find it. By fall, you start developing systems and things begin to get a little bit easier. By winter, you're much more competent, but fatigue starts accumulating. Then sometime in the spring, something interesting happens. You'll watch a new student struggle with something that now feels completely routine to you, and you'll realize, I've actually gotten pretty good at this. So don't judge your future as a surgeon based on how you feel during July. You're not supposed to feel comfortable yet. This was probably one of my biggest adjustments that I had to make during intern year. As an intern, there's always something else you could be doing. Another note, discharge, another patient you could check on, another chart you could review, another article you could read. If your definition of success is finishing absolutely everything, you're going to feel like you're failing constantly. Instead, learn to ask what has to happen now, what needs to happen today, and what can safely wait until tomorrow. You cannot empty an infinite inbox. Your job is to make sure the right things happen at the right time and that patients don't suffer because of your actions. And that leads directly into triaging your workload. Imagine that you have 6 things happening at once. A discharge needs a med rec completed, someone wants a family update, there's a potassium of 3.4, a consultant hasn't called you back yet, a nurse wants a bowel regimen changed, and another patient is suddenly hypotensive. When you're overwhelmed, all 6 can feel urgent, but they're not. I like thinking about it as sick patient first, then time-sensitive tasks, and then things blocking the flow of patient care, then routine tasks. You don't need to do everything immediately, you need to do the right thing next, and that distinction will save you a tremendous amount of stress. There are certainly going to be moments during intern year when you completely lose control of your list. You're getting interrupted constantly, you're starting 5 tasks without finishing any of them, and suddenly you don't even know what to do next. When this happens, stop for 60 seconds, actually stop, and rewrite your list. Circle the 3 most important things, ask yourself, is there anything dangerous I'm forgetting? Can anything appropriately be delegated, and does my senior need to know that I'm underwater? One of the lessons of residency is that asking for help before things become unsafe is much better than pretending you're fine. When you're overwhelmed, don't just move faster. Reset, prioritize, and then move. Intern year gets way easier when you learn the art of the page. The pager is another thing that can control your entire life as an intern. Early on, every page feels urgent. Eventually, you learn that a page is simply new information. When you get one, establish who is the patient, what changed, are they sick or stable, how urgently do I need to respond, then decide, can I handle this remotely, do I need to see the patient, or do I need help? Eventually, patterns start repeating, and the pager stops feeling like this random source of anxiety and starts becoming something you know how to triage. When in doubt, go and see the patient, and then establish a plan and present it to your senior. Night float is also a completely different skill. During the day, you might know 10 patients extremely well. At night, you're suddenly covering many more patients that you barely know, so your job changes. Identify who is sick, deal with problems that can't wait until morning, know when to escalate, and leave a good handoff. And when you're giving sign-out, don't just read the chart. Give the next resident information that they can actually use. Surgical patients get the best care whenever handoffs are done correctly. When you're giving sign-out, don't just read the chart. Talk to the next resident about why you might get called about the patient, what should you do if that happens, when you should escalate to your senior or attending, and a good handoff transfers anticipation, not just information. Here's something that nobody puts in the surgery residency brochure. Discharges can absolutely wreck your day. Because a discharge isn't just clicking a button, there might be medications, follow-up, wound care, drain teaching, equipment, transportation, home health, or consultant recommendations. So don't start planning a discharge when the patient has to leave, start the day before. Ask what is going to prevent this patient from leaving tomorrow, then remove as many of those barriers as you can today, and make sure to always talk to social work. A huge part of surviving intern year is simply learning to solve tomorrow's problems today. A huge part of intern year is learning how to take constructive criticism and feedback. It doesn't get talked about enough, and you'll be corrected very frequently. Sometimes the feedback will be delivered really well, sometimes it won't be. Try to separate the message from the emotion that you feel receiving it. Ask, is there something here that can make me better? Take that part, because making a mistake and thinking I should have done that differently is very different from thinking I don't belong here. You're also going to have genuinely terrible days. Every intern does. When that happens, ask yourself, what actually went wrong? Is there anything I need to fix tomorrow? What would I do differently next time? Take that lesson, then let the day end. Reflection makes you better, rumination just makes you tired. Intern year will consume as much of your identity as you allow it to, and I'm not going to pretend that you're going to have perfect work-life balance during surgical residency, let alone intern year. You definitely won't. But protect something outside of the hospital. Your relationship, your family, the gym, golf, video games, whatever reminds you that you're a person outside of surgery. A huge part of intern year is use your days off like they matter. Please don't turn every day off into another productivity contest. You don't need to wake up, work out, meal prep, study for 3 hours, do research, clean your apartment, and somehow optimize every second. Sometimes you just need recovery. Recovery is definitely part of training, and an important part. Strangely, July might not be the hardest part of intern year. Winter can be really tough. The novelty is gone, you've been working for months, the weather is terrible, you're tired, and graduation still feels far away. When that happens, don't compare yourself to yesterday. Compare yourself to July. Think about everything that used to make you nervous that you can handle without even thinking about it. Progress during residency can be difficult to see because you're living inside of it. Measure your progress in months, not days. So if you're about to start intern year, you do not need to have all this figured out on July 1st or even by December. You won't. You're going to have difficult rotations, you're going to make mistakes, you're going to have days where you feel overwhelmed, but slowly the things that used to feel impossible become routine. You survive, you adapt, and you grow. The goal of intern year isn't perfection, it's becoming a little better every day. Thank you so much for tuning into this episode of Cutting the Boards. Make sure you subscribe to my channel. As always, study smart, stay consistent. Your future patients will thank you for it. I'll see you in the next video.